Hello everyone, welcome to the show Talk with Your Doc. I am Dr. Prashant Jani and our guest for today is Dr. Laura Power. Thank you Dr. Laura Power for coming today. She is Chief of Obstetrics and Gynecology at Thunder Bay Regional Health Science Centre in Thunder Bay, Ontario, and we are very happy to have her. She is also Assistant Professor at Northern Ontario School of Medicine. Thank you, Laura.
Thanks so much for having me.
You know, during the COVID time, I was talking to some of my friends and they called me and said they are pregnant now and the COVID is around. So what sort of precautions they should take? Or some of them had a pre-existing diseases like diabetes. So they were really nervous. So please tell me your experience with the patients with pregnancy and COVID-19. How did you handle those patients?
Yeah, so that's a really loaded question. So we do know that patients who are pregnant who get COVID actually have a higher risk of becoming more sick. Oh. So women who are pregnant and contract COVID have a higher risk of becoming ill enough that they end up in the ICU requiring ventilation support.
Because pregnancy itself is a higher risk factor?
I think so. We're not entirely sure. But thankfully in our city, our experience has been that most women actually recover just fine. Oh. And so if you are pregnant and you have COVID and you recover, then everything else is fine. There haven't been any reports that babies have contracted COVID in utero. Sometimes we might monitor the growth of the baby a little more closely, but really the evidence doesn't support that.
So Thunder Bay had no major mortalities with the COVID-19 and pregnancy. How about the global situation?
Yeah, the global situation is tough because the reporting is kind of inconsistent between countries, but that's sort of where we're getting our data from, where there was a higher risk of serious disease in women who were pregnant.
Leaving COVID aside, if somebody wants to become pregnant, is there any doctor's advice required before getting pregnant?
Yeah, so people who are planning on getting pregnant should probably see their doctor if they haven't seen them in a while, just to make sure that they're healthy, that they don't have pre-existing things like diabetes or anemia. They should start taking prenatal vitamins at least 3 months in advance. Because the prenatal vitamins have folic acid, which is important. Some women can't tolerate the prenatal vitamins because they can cause nausea or stomach upset. So the most important vitamins to take would be folic acid and vitamin D.
So that is prescribed by the doctor when they visit before the pregnancy.
You can actually get this over the counter.
Over the counter. Now, some of the patients, they don't have either family doctor or they don't know any obstetrician or gynecologist. And I get quite a few people calling me that where should they go now? So what would you advise for them?
So people who discover that they're pregnant and need prenatal care need to know that it's important to get prenatal care right away. And you can get care almost anywhere. So you can refer, if you don't have a family doctor, obviously that would be your first place to go. But if you don't have a family doctor, you could go even to a walk-in clinic. Mm-hmm. But we do have the maternity center at the hospital, which takes self-referrals. So patients can just call the maternity center at the hospital and a nurse practitioner will see them right away. We also have midwives in town who will also see patients on a self-referral basis.
What is the difference between the care provided by midwife, a nurse practitioner, and a family doctor?
That is an excellent question. So midwives are essentially specialists that deal with normal pregnancy. So they can look after almost anybody who is healthy and pregnant and having a normal prenatal course. And the benefit of midwives is that they do look after the baby for about 6 weeks after the baby's born. Nurse practitioners are also able to do prenatal care, but ultimately they would refer to either a family doctor that practices obstetrics or an obstetrician. The family doctors in town that practice obstetrics can look after slightly higher risk patients than the midwives can, and they can also provide care to the baby after birth and potentially continue to provide care for that baby throughout its life as it grows up. And then finally, obstetricians like myself, we specialize in all types of pregnancy, especially high-risk pregnancies. So we can accept referrals from the maternity center or from any nurse practitioner, doctor, or midwife.
So midwife is just a walk-in, or do you have to register somewhere, or how does that work?
I actually don't know for sure. So, but I do know that you can call the midwives if you know that you're pregnant, and they will register you.
So this is antenatal care before before the delivery. So is there any investigations are ordered by midwife or family doc during the pregnancy?
So yes, for sure. Your prenatal care comes actually with a lot of tests at first. So initially there will be blood work that's ordered. We're looking to see if you have anemia. We look for your blood type. We do screening for certain viruses that could potentially harm the baby. We also will do an ultrasound, which is really important to date the pregnancy and figure out what the accurate due date is.
So all these investigations, they are done during first few weeks of the pregnancy?
Those are the first trimester investigations, which include that ultrasound, and typically those are done before 12 weeks.
So how frequent should a patient visit to a midwife or obstetrician or a family doctor for antenatal care?
Yeah, that's also a great question. So if you're seeing an obstetrician, typically we will see patients every 4 weeks for the first 2 trimesters, and then we'll see them every 2 weeks after that. And when patients reach 36 weeks, they will be seen once a week. But if it's a higher risk pregnancy, we may see them more often.
What is high risk pregnancy? Like, is there any particular disease associated with the pregnancy, or what is it? Why it is high risk?
You ask really good questions. So high-risk pregnancy, that is also a bit of a complicated question, but anybody can become a high-risk pregnancy, that's the thing. But to start off the bat, if a woman has a pre-existing medical condition like diabetes, obesity, or high blood pressure, she would automatically be high risk.
So then they are frequently screened?
And yes, they're typically seen more often and referred to an obstetrician. Throughout your pregnancy, you can be low risk and then become high risk if you develop gestational diabetes or gestational hypertension or preeclampsia. If it's discovered that you have more than one baby inside, so twins or triplets. There can be problems with the placenta, which is why ultrasounds are important early in pregnancy. There's actually a lot of things that can result.
So anybody has a high risk pregnancy, they should especially visit more frequently to the doctor, then?
Yes, exactly. So typically, if you have a care provider, then you would be seen more often and referred to an obstetrician.
Because it's a risk factor for the mother as well as for the child, is that correct?
Both, yeah. And so that's the exciting thing about my job is I have 2 patients. I have the pregnant patient and the fetus. So I have 2 patients. And so a patient can be high risk in either way.
Right. Now, do you give any medications or drugs during the pregnancy, and are they safe?
Again, that depends on what the medication is. So another example of a high-risk pregnancy would be patients with a seizure disorder. So we would have to work closely with their neurologist to make sure that their seizure medication is safe in pregnancy, because not all medications are safe. So it's important to review your medications with your doctor.
So somebody who is pre-existing hypertension, they can continue taking the medication, or they have to talk to the doctor? And
they should talk to their doctor, because some medications aren't safe to take in pregnancy.
Okay, so you should consult a doctor and then continue. We'll take a short break and we'll continue our discussion.
Sounds good.
Thank you. Thank you, Dr. Power. Thank you, everyone, for coming back to the show. And we were talking about medications during the pregnancy and the high-risk pregnancy. Physical activity during the pregnancy, this is a very important issue. People are working during the pregnancy or exercise during the pregnancy. would you recommend it is safe to do workout during the pregnancy, or is there any contraindication for the same?
Exercise is generally a really great idea in pregnancy. So we typically would not recommend that people start a whole new exercise routine as soon as they find out that they're pregnant. But everyone has a different level of activity that they consider normal. And so our advice would be to continue that activity as long as they can. Eventually, it's going to get more difficult as women get short of breath and their belly gets in the way of certain things. But the advice would be to continue physical activity because it's going to make your labor easier. It helps to prevent diabetes. It helps to control weight gain in pregnancy. And it also helps to improve your mood.
What sort of exercise would you recommend during the pregnancy? Is like a yoga or stretching exercise, or is any particular would you recommend has a positive effect on the pregnancy?
For someone looking, maybe say they're not super physically active and they're pregnant and now they want to make some lifestyle changes, I would recommend gentle activities. So things like swimming, walking, prenatal yoga, those are all really great things to start with.
Right. Now, is there any side effects of doing exercise during the pregnancy, like any contraindications?
There's generally no contraindications unless your doctor tells you so, but that would be rare complications in pregnancy that would prevent exercise. But things to watch out for really is just to notice how your body feels, and if things are starting to get more difficult, you're having difficulty breathing, that's normal in pregnancy because the lung volume is decreasing as the belly increases.
Yes.
And so it's important to pay attention to how you feel and not overdo it.
Traveling during the pregnancy, quite a people have a question that how do you wear the seatbelt during the pregnancy?
Yes.
Will it have a compressive effect on the baby inside? So what would you recommend?
That's a great question because, I've definitely seen patients and emerge who are pregnant and have been in car accidents and were not wearing their seatbelt properly. It's important that the strap actually goes across and then underneath the belly, so not over top, because we don't want to have any impact to the pregnant uterus. So the seatbelt's supposed to go underneath and then across your chest against your shoulder.
Right. Now, smoking or alcohol, is it advisable in the pregnancy? Quite a few people are occasional smoker or chain smokers. So what would you advise for them?
So really no amount of smoking is recommended in pregnancy. Smoking can increase the risk of hypertension or high blood pressure in pregnancy or preeclampsia. It can also make babies smaller and it increases the risk of preterm birth as well. Alcohol is associated with birth defects, so really no amount of alcohol is considered safe. The reality is that we actually don't know what the safe amount is, and so that's why we say no alcohol.
No alcohol, no smoking.
No alcohol, no smoking.
No opioids or anything else.
Opioids are a tricky thing. We do have an opioid crisis in our region, and a lot of women struggle with that. And it's important to know that opioids do not cause birth defects, and it's really difficult for women. It's not advisable to stop opioids during pregnancy because that can actually increase the risk of stillbirth and other bad outcomes. So, we work really hard to try to support women to continue taking their medications safely, and then we help support the babies once they're born.
Now, during the pregnancy, we are taking all these antenatal cares, but there might be some warning signs or red signs. What are those signs we should watch for that now there is a danger in the pregnancy? Is there any such thing?
For sure. So the biggest red flag is actually not feeling the baby move.
Okay.
So you should feel the baby move at least 6 times every 2 hours, starting after 26 weeks. And as the baby gets bigger, those movements are going to get smaller, but they still need to be as frequent. So it may not be a big roll, it might just be a little wiggle, but it's important to feel the baby move.
Feel the movement of the baby, and if that is not moving, then what should they do?
If it's not moving, they should call their healthcare provider. So if you're seeing an obstetrician, that would be calling labor and delivery right away.
So is there any reason baby not moving physiologically?
So
Just
generally,
baby sleeping, for example.
exactly, yeah, babies do actually sleep. They
Yeah.
have sleep cycles that happen more often during the day, unfortunately, so they're awake at night. So that's not a myth. Babies do move more at night and keep moms awake. But, you know, other things that we worry about, could there be a problem with the placenta or the umbilical cord? And so it's important to present early if that's the case.
So what are the other danger signs? Baby not moving is one of the signs. Anything else would you like to say?
Yeah, so women who have a new onset headache that's really, really strong and they've never had that before, and it's accompanied by visual changes, so like flashing lights or spots in their eyes. You know, really, labor and delivery is open 24/7, and anyone can call that number after 20 weeks of pregnancy.
So what are the causes of headache or flashing?
We worry about things like preeclampsia.
Okay, what is preeclampsia? Can you please explain something to our viewers?
Yeah, preeclampsia is when you have really high blood pressure, but it's associated with a problem with the placenta. So it's a risk both to mom and to the baby.
So blood pressure shoots very high.
Very high, so it makes women feel crummy. It gives them a headache. They feel very unwell. It can result in seizures.
So is it like an emergency thing?
Very emergency, yeah.
So they should go to the emerge or go to the doctor
Yes.
right away?
Yeah, right away. And usually when you're having your care with your care provider, it doesn't matter if it's a midwife or an obstetrician or a nurse or a family doctor, that's part of the routine care is screening for that. So everybody will get their blood pressure measured, and we always ask about those symptoms at every visit.
So two things you mentioned. One is movement of the baby and headache or any flashing of the lights in front of the eyes. Anything else like bleeding or anything one should observe?
Yes, so that's also great to point out. So any signs of vaginal bleeding, or if your water broke, that's okay, actually. It's not an emergency, but your healthcare provider should know right away.
Now, this is before the pregnancy, delivery. Now, during the delivery, there might be option of vaginal delivery or cesarean section. So how do you choose the option?
The choice is hopefully always a vaginal delivery. That's what we want to go for. That's the most natural and healthy way to have a baby, but that's not always possible. And so the decision to go to a cesarean section would be made with the obstetrician.
Okay. Is there any risk factors associated with cesarean section rather than vaginal delivery?
So risks in pregnancy that would lead to a cesarean section? Yeah. If the placenta is covering the opening to the uterus, then for sure you would need to have a cesarean section. If there are problems with the baby's heart rate, if we're worried and we need to get the baby out emergently, usually that's when we're doing a C-section. And then if women have had a previous C-section, it's usually their choice if they want to try for a vaginal delivery or have a repeat C-section.
Thank you, Dr. Laura Power. We'll take a short break and we'll come back for the next part of the show. Please come back for the next part. Thank you. Hello everyone, welcome back to the show Talk with Your Doc, and we have Dr. Laura Power, who is obstetrician and gynecologist at Thunder Bay Regional Health Science Center. Thank you, Dr. Laura Power, for being with us on the show. We just talked about cesarean section, high-risk pregnancy. Once the baby is delivered, then that is called postnatal care. So can you please tell us how frequent a mother should visit obstetrician after the delivery is done?
Yes, so that's a great question. An obstetrician is just looking after the mother. So we would typically see that patient at the 6-week mark postpartum, but if there were any risk factors, we would see her sooner. Say if we needed to measure her blood pressure a little earlier, or if she had a C-section, we might check the incision a little bit earlier.
Now, the patients who had diabetes during the pregnancy or hypertension during the pregnancy, does it come back to normal after the pregnancy, or it stays throughout the life?
Well, typically we blame all of this on the placenta, so it should get better after. But we do know that women who have these conditions in pregnancy are actually at a higher risk for having these conditions later in life.
So long-term diabetes or long-term hypertension, should they go to the family doc, or to obstetrician for the regular monitoring? How do they do?
So for women who've had gestational diabetes, at the 6-week mark, we will recheck them for diabetes. And if that's negative, then we just recommend that they're rescreened according to guidelines. There are some guidelines that suggest that they should be screened once every year for diabetes, but I'm actually not sure if that falls under the choosing wisely.
Is that they are diabetes during the pregnancy is risk for developing long-term diabetes even at a later age?
Even at a later age, yes. And then the same goes for high blood pressure in pregnancy. We do know that women who've had that in their pregnancy can go on to have high blood pressure later in life and potentially have a higher risk of heart disease.
Now, patients having HIV and pregnancy, so what is the risk for baby if the mother has HIV?
Yeah, that's a great good news story that we have. So HIV has now become almost entirely preventable in the fetus and the newborn. So women who have HIV should present to care as soon as possible because we can start them on medication that prevents that vertical transmission.
So is the baby at a risk? So then some sort of medications can prevent risk for the baby as well?
Yes, yeah, the antiviral medications can prevent the risk to the baby almost 100% of the time nowadays.
And is that the same for other diseases like hepatitis or any other infectious diseases?
It's actually not. And so depends on what the infection is. Hepatitis, it can be hepatitis B or hepatitis C. There are things that we can do to prevent transmission, but it's actually not a success story like HIV.
Coming back to the COVID now, is it safe to take vaccine during the pregnancy or before the pregnancy or after the pregnancy? Can you please explain this a little bit?
Of course, yeah. So that's a great question. It's super controversial. But the data that we have show that the COVID vaccine is entirely safe in pregnancy. What happens when you get vaccinated is your body makes antibodies. So the vaccine itself is not transferring to the baby. The antibodies do, though, and so when you are vaccinated in pregnancy for things like COVID or even pertussis, which is another vaccine that we recommend in pregnancy, you can pass those antibodies to your baby and then your baby will be protected.
So vaccine is safer during the pregnancy?
100%. Not all vaccines are safe, though. So things like the measles, mumps, rubella vaccine or the chickenpox vaccine, we don't recommend in pregnancy.
Now, after taking the vaccine and after taking all the care, all the medications, baby is delivered. Now, postnatal care of the baby as well after delivery of the baby. I know as obstetrician you don't deal much with the babies, but is there any advice you will regarding the breastfeeding? What advice would you say to the mothers?
Yes. So typically, things that I look for are mood and bonding with the baby and any breastfeeding issues. So I'll start with breastfeeding. The pendulum has kind of swung the other way. I think a long time ago, probably when I was a little baby, maybe breastfeeding wasn't as favorable. But now I wonder if the pendulum has swung a little bit too far. Breastfeeding is certainly the best thing for babies, but a lot of women just can't breastfeed.
Why the breastfeeding is the best? What is that in the breast milk which helps baby and mother?
Yes, so breast milk has antibodies in it, so it helps to protect babies from infection. It's the most cost-effective method of feeding your baby. It helps to promote maternal weight loss. It helps promote bonding. There's a lot of benefits. Babies who are breastfed seem to have a decreased risk of diabetes or chronic disease later in life. And so there are lots of benefits to breastfeeding. But I do see a lot of women who can't breastfeed for whatever reason. And so we would have to go with formula in that case. And it's a little bit of a touchy subject for me because I watch women struggle, and truly half of us were raised on formula back in the day,
Yes.
and we all turned out just fine. So I think the pendulum has swung a little bit too far. We're putting a lot of pressure on new moms to breastfeed, and even though it is the best thing, it's not the end of the world if it can't be done.
And one last thing about the colostrum. Please tell us about about something about colostrum. What is it? How it helps baby and mother?
Yeah, so colostrum is the first little bit of breast milk that comes. It sometimes arrives before the baby's born. We have lactation consultants at the maternity center who can help with that, but it's possible to collect the colostrum and save it for when your baby is born. And the benefit of colostrum is that it contains a lot of those antibodies that help prevent infection in the newborn.
Now, we talked all about the mother and the baby. We didn't talk about the partner. So what is the role of a partner in healthy pregnancy? Please tell a little bit before we end the show.
Sure, partners are very important. That partner can be anybody, somebody who's going to support that pregnant person throughout their journey. It's hard. The body changes so much. Mood is going up and down. It's, very difficult to do something like this on your own. And so a support person is essential. Studies show that women who have a support person with them in labor do better. There's a decreased risk of C-section, decreased need for analgesia or pain medication. I can't overstate how important a partner is.
So emotional, physical, social support, all is important for the partner.
100%.
It's a teamwork.
It is.
Thank you, Dr. Laura Power, for coming and helping us with the show.
Thank you so much.
Thank you, everyone, for coming to the show, Talk with Your Doc. We'll see you for the next show again. Thank you.